Okay, are you guys able to see my screen?
Yes.
Perfect. Okay, well, hello everyone. Thank you so much for joining us today for Project Echo 103 informational session. I'm just going to give you guys a brief introduction to the topics that we're going to cover for Echo 103 and also some backgrounds on the presenters that we have lined up for you. But before we get started, I would like to go around and give a very brief introduction. I just need your name and the organization that you work for. So I'll start. My name is Gina Perajuli. I'm the program specialist for Integrated Healthcare Initiative here at Mental Health America of Greater Houston. I've been in MHA for about 10 months now and have been taking over Project Echo series since Echo 102. I'm joined by Mariah, my amazing colleague, so she can introduce herself now.
Hi, everybody. My name is Mariah McIntosh. I have been with MHA for 5 months now, and I'm a program and admin assistant. And I've been assisting the integrated healthcare team with some of their projects that they've been doing. So very happy to be here and will be providing any technical support or questions that you guys have.
Thanks, Mariah. Sarah, you're next.
Hi, I'm Sarah Bogart, and I'm with Harris County Public Health.
Janelle, you can go next.
Hi, Janelle Wheeler. I'm also with Harris County Public Health.
Thank you so much. Takesha, you're next.
Hello, my name is Takesha Tipano, and I'm an elementary school counselor for Fort Bend.
Lisa, you're next.
Hi, I'm Lisa with San Jose Clinic. I'm a practice and quality manager.
Thank you so much, Lisa. Heather, you're next.
Hi there, I'm Heather Green with Harris County Public Health.
Thank you so much. Marcella, you're next.
Hi, I'm Marcella Webb. I'm Director of Network Management for AmeriGroup Texas.
Thank you so much. Tiffany, you're next.
Hi, everybody. I'm Tiffany Shafi. I'm a nurse and a project director at the Colorado Center for Nursing Excellence.
Thank you so much, Tiffany. Seema, you're next.
Hi, my name is Seema Shah. I'm a child and adolescent psychiatrist with the Meadows Mental Health Policy Institute and a senior fellow of pediatric health policy there. Nice to meet all of you.
Nice to meet you as well. Thank you so much for joining us today. I am now going to share my screen. Okay. Able to see my screen?
Yes.
Yes. Perfect. Okay, so before I talk about our module, I just wanted to give you guys a brief background on what ECHO really is and how it came about. So Project ECHO was actually founded by Dr. Sanjeev Arora in New Mexico to ensure the right knowledge existed at the right time and at the right place. So the ECHO model is all teach, all learn approach, which started out as an infrastructure for knowledge sharing in rural and underserved communities around the world. Today, ECHO has really evolved and is used worldwide in a variety of sectors as a platform that connects group of community providers with specialists at centers of excellence in regular real-time collaborative sessions. And they've been using Zoom to connect with everybody around the world. And they've been doing this even before pandemic started. So way before we started using and normalizing Zoom. Experts and participants really connect and learn from one another in this platform. They share their experience and they also get to access some critical and life-saving knowledge while receiving mentorship and ongoing support to make a difference in their community. Okay, I'm gonna end it all. So our Project ECHO model focuses on integrated healthcare. We have worked with experts throughout the state state of Texas actually to develop a very comprehensive and comprehensive curriculum. And we've rolled them out in 3 various stages: Project ECHO 101, 102, and now we're on to 103. And we've made sure to cover the important things that the practices need to know and learn about infrastructurally to prepare and have your team ready for integrated behavioral health. So if you were a part of this journey with us and attended Project ECHO 101, 102, and now plan to attend 103, one of the experts who actually helped us put this together or helped us develop this series told us that if someone goes through the entire module, they're going to be ready for integrated care, as it is a very robust learning experience, and you'll be able to learn and understand some of the things and be ready to implement integrated behavioral health. And I'm sure many of you may have already done it in some form or fashion. So then this can really help you to make adjustments, learn from one another, and hear about some really difficult challenges that others have gone through. But most importantly, you get to gain knowledge and resources that you need to move forward with your integrated care expansion. So this is the format, that ECHO format that we have to use. So the ECHO format is first instructed by the subject matter experts. We have experts that have been doing integrated care for at least a couple of decades. And these experts are people throughout the nation. So they're from all over the country. We want to provide our participating organization the support they need. Therefore, sometimes even after the ECHO session is over, we can help you connect with these experts if you have more questions and need further guidance from them. They're even available after the session, but during the session, we typically do 20 to 30 minute didactic session, focusing on the subject area and the topic for the day. And then the experts get to share their knowledge and understanding of the topic. And then the half of the other time of the session is dedicated for case consultation. I'm going to talk about case consultation and what it looks like and what we do with that later. But so some time are dedicated for case consultation, questions and answers, and conversations, which is really the crucial part of our ECHO session, because that is where people have found ECHO to be really enriching and really a great learning experience for the work that they're doing in the integrated behavioral health. So these are our topics for ECHO 103. I just wanted to give you all a brief introduction of each of these topics. And by the way, if any one of you are interested in learning about ECHO 101 and 102 modules, we have recorded each of those sessions. So please let me know. You'll get my email address at the end of this presentation. Feel free to reach out to me and I can send you the recordings of all of those sessions as well. But for Project ECHO 103, we will actually take a deeper dive into some of the challenging issues of integrated care. We'll discuss some models and as well as some strategies for creating psychologically safe workplace. One of that includes self-care for integrated healthcare team, quality metrics and measurement tools, quality improvement, and lastly, never giving up, sustaining operationally and financially. I mean, we recognize the challenges of paying for integrated care on fee-for-service operations. Therefore, our goal here at MHA is to really support practices and clinics to move towards value-based contracting. So we'll have some discussion around that in this module as well. We have lined up some great presenters for this topic. I cannot say enough good things about these speakers because I've gotten to work with most of them very exclusively, and I know how amazing they are, and I'm very excited to have them as part of our ECHO 103 presenters. So just want to give you guys a brief introduction of each of these presenters that we're going to have. So first we have Dr. Angela Cummings. Many of you may know her. She has been a part of MHA for many different occasions in different projects, but Angela Cummings is an assistant professor in the section of public health and child abuse pediatrics at Baylor College of Medicine. She's the evaluator for multiple projects to improve health and well-being of children and families. Some of her projects include Plan of Safe Care, integrated behavioral health in pediatric practices, and a community outreach program for pregnant women at risk of substance use disorder. So she'll be our presenter for the quality metrics and tool topic. Then we have Dr. Ebony Winford. Dr. Ebony Winford is the Director of Research and Health Equity, and she's a licensed psychologist at Cherokee Health System in Tennessee. She is the clinical lead of CHS Cherokee's consultation and training program, which provides individual on-site training to other primary care organizations as they seek to integrate their practices. She also oversees research initiatives that includes those that are actually funded by HRSA, the Tennessee Department of Health, and NIH. So she will be our presenter for strategies for sustaining, never giving up operationally and financially. So she'll be covering two of the topics. And if you guys have seen her before and were able to experience her live, if not, this is going to be a great opportunity for you. She's going to be here for 2 sessions, and I highly recommend being a part of those because she really knows her stuff, and when she and is really able to give you great guidelines on those 2 topics. Then we have Florence Gerber. Florence Gerber is she specializes and practices operational continuous quality and performance improvement. She partners with government, education, and healthcare organizations. She focuses on collaborating with leadership and frontline staff to create a trusting dialogue with cross-functional work groups where participants feel safe to share innovative ideas for improvements. She brings with her 25 years of experience leading improvement projects. She uses evidence-based methods and techniques through facilitation, education, and coaching. So she'll be our presenter for the quality improvement topic. Then we have Christy Ward. Christy Ward is the Chief Executive Officer of Share Ourselves, SOS. It's a FQHC organization that operates 6 clinic locations in Orange County, California. She's also a licensed practical nurse and is a current board member of California Primary Care Association. She'll be our presenter for the self-care for IHC team topic. Then we have Dr. Stacy Oakbide. Dr. Stacy Oakbide is nationally known for her expertise on integrated behavioral health. She is a behavioral health psychologist. She started integrating behavioral health actually here at Healthcare for Homeless in Houston. She's now a professor at University of Texas San Antonio in their psychology department and in their integrated behavioral health department. So she provides behavioral health consulting services to one of the clinics that she works in and teaches other psychologists how to be a behavioral health consultant. So she'll be our presenter for creating a psychologically safe workplace topic. Then we have Dr. Naftali Serrano, who is the Chief Executive Officer of the Collaborative Family Healthcare Association. It's a national nonprofit organization dedicated to promoting integrated care as the standard of care for all. So he has devoted the majority of his career to working with FQHCs, starting integrated care program and consulting with clinics in underserved setting to assist with implementation of PCBH, which is Primary Care Behavioral Health Program. Dr. Serrano's research interests also include program development, evaluation, and outcome studies related to PCBH, particularly in underserving settings. And he'll be our presenter for the review, challenges, questions, and what's next topic. So he's going to pretty much wrap up our ECHO 103 series. Then we have Ken Yanda, who is the founder and managing principal of Wild Blue Health Solutions. Wild Blue Health Solution is a Texas-based consultancy advancing new care and payment models, increasing coverage options, and connecting our most vulnerable populations to healthcare access. Prior to starting Wild Blue, Ken served as a CEO and president of Community Health Choice for 11 years. Ken is also a lecturer at Rice University's Jones Graduate School of Business, teaching the essential of health insurance and healthcare financing, and also an adjunct professor in population health at the University of Houston College of Medicine. He's passionate about connecting every Texan to quality, affordable care. So he'll be our presenter for the value-based contracting topic. Then we have Dr. Gabriela Gibson Lopez. She's a licensed psychologist and an assistant professor of family and community medicine. Her clinical and research interest includes education and training of health professionals, behavioral health management of chronic health conditions, and the integration of behavioral health into the primary care setting using PCBH model. So she will be our presenter for PCBH and hybrid model topic. So these are our presenters that we've lined up for you guys for ECHO 103. And I wanted to briefly talk about a case consultation form. Just want to show you what it looks like. Can you let me know if you can see the form?
I see the link, but not the form.
You see the form?
Just the link.
Just the link.
Oh, just the link. Okay, then I'm gonna
You might have to unshare and then
share.
reshare.
Yes, I'm gonna do that right now. Stop share. Okay. You guys can see it now? Okay, so this is what the case consultation form looks like. So what we do with this is if you guys have registered for ECHO 103 sessions, for each of the sessions, you will receive a reminder email from me. And in those reminder emails, I put a link to this consultation form. And once you click on the link, you'll be prompted to this page. When you get to this page, you'll get to include your information here and then choose the topic for which you need consultation from the experts who are going to be a part of that topic. So you pick the topic here, then you can describe your challenge here, and then also talk about any changes that you've made or that is in progress. If you have made the change, describe that here, and also what vision you see for the changes that you are trying to make in your organization, and any additional information that you would like the experts to know. So what I do with these is once I receive this from your end, I send this to our presenter of the day, and they get to review this before their presentation. And once they complete their 20 to 30 minutes didactic presentation, the other half is where we discuss these questions and concerns. But it doesn't stop there. If you guys need more one-on-one or sometime after the session, that can also be arranged. But this really helps them to give you better guidance and resources that you need, which is why we've created this here. So please do take advantage of this whenever, if you have any questions or concerns and you think the experts would be able to help you. Okay, now going back, I'm just gonna do this. And that is actually all. I'm gonna open up the floor for questions. If you guys have anything, any questions or concerns, this would be the time to unmute yourself and ask any questions that you have, or type it in the chat box, whichever works for you. Surely I'll send you the echo training, all of the sessions that we've recorded. You're welcome.
I just want to say that the presenters that you have lined up look like a really good bunch. I've seen a couple so far, and so I'm definitely excited.
Yes, we have, I'm really proud of what we have put together, and I really hope that this will be helpful for you guys if you guys are able to attend any of the sessions. They're really amazing and have really done integrated care for quite some time now, so they'll definitely be able to give you some guidance. Yes, Lisa, I'll send you some of the, do you guys want Echo 101 and 102 recorded sessions?
Yes, please, if you can. Thank you.
Sure thing. Yeah, I'll do that. Sure, Sarah, I'll send you series 2. Any other questions?
I just have a quick comment, if that's okay, and wanted to make sure it was okay that I joined these sessions. So I work with all those people pretty closely.
Nice.
One of them, yeah, they're all members of CFHA, and I integrate behavioral health care in rural Colorado primary care clinics. So love PCBH model. I love all those people that you guys have presenting, really powerful people. Naftali is one of my favorite people in the world, and Dr. Ogbide is amazing. Also work with Florence Gerber at the IPCI Institute. She's amazing too. But I'm on this call because I love hearing, what people are asking and what they're going through trying to integrate care, do integrated care. And so I really wouldn't need to fill out that form. I would just be here to hear, Dr. Ogbide and Naftali answer questions in the brilliant way that they do. And so that's why I'm here. I don't necessarily need a lot of support with it because I understand it very well because I do it and implement it and coach it and train it all day. But I want to just be here to be present with the people that are going through it. So I just wanted to make sure it was okay that
Absolutely. Yeah, the case consultation form is not mandatory. It's there for you as a resource, a way to connect with the experts. So if you have any questions, that's why it's there. You can fill it out, and it comes to me, and I'm then able to share it with the experts. But yeah, if you just want to join and hear them out and just experience it, then that's totally fine.
Okay, great. Thank you so much for answering that question. I appreciate it.
Yeah, no problem. Anyone else? I also want to apologize. I didn't realize there was an issue logging in this morning. I apologize for that. Okay, if you guys don't have any question, then I'd like to end early. So thank you all for joining today. If you need a copy of this session as well, then feel free to email me and I'll be happy to send them to you. But if not, have a good day.
Thanks. Everyone have a good weekend.
Bye,
Thanks
Sarah.
so much.
Thank you.
Bye.
Bye, Seema.
Bye. Thank you.
Suji and I went ahead and jotted down who wanted recordings, but it looks like everyone is sort of interested in that.
Yeah, so I have a couple. I have Charlie, I have Mariah. Can you stop recording first?
Oh, yes.